Hello, and welcome to the next episode in the CPFT series, Coping with Worry, Anxiety and Depression. This is episode 3, Managing Anxiety, part 8, Mindfulness. I'm Sarah Hughes, a psychotherapist and mindfulness teacher in the Huntingdon Psychological Wellbeing Service. Mindfulness has been scientifically shown to be beneficial in managing chronic stress, illness, and relapse prevention in depression. It's about learning to manage your attention so that you can be fully present to what's most helpful to you in each moment. It improves your skills with seeing the difference between direct sensory experiences and the thoughts and judgments we make about experiences. Mindfulness is a skill of observing that we are all born with, and a skill which can improve with repeated practice. You can read lots about mindfulness, but it's really based on your experience. So I'd like to start with a short exercise which you can use to settle and ground yourself any place, any time. So first, set up a posture that's comfortable for you. Maybe seated with the feet flat on the floor, the back straight but not stiff, and just beginning to notice the sensations of the point of contact between yourself and whatever it is you're standing or sitting on. During the exercise, try to keep your focus on these sensory qualities. Whenever you notice your mind wandering off to judging whether you like or dislike what you sense, or if your mind wanders off on some kind of story about whatever, gently bring it back to sensing. And whether you have to do this once or 1,000 times, it's absolutely fine. The point is to notice that you've wandered and come back with an attitude of kindness. So we'll begin and end this short practice with the sound of a bell. So as the sound of the bell fades away into the background, just begin to look at the environment around you and just gently try to locate 5 objects that you can see. Really focus on the sensory qualities. What's the texture, tones of colour, shape? How does the light hit this object? And in your own time, just beginning to locate 4 things that you can feel right now. Maybe the movement of air on the skin, temperature differences in the body, textures of fabric, tingling, numbness. Maybe the movement of your breath, maybe your heartbeat. These are just my suggestions. What do you notice in your environment, in your body? Noticing 4 things. And gradually shifting your attention to noticing 3 sounds in the environment. Listen out for the quiet sounds underneath the loud and obvious sounds. Is there a clock? Is there a difference to the electricity hums around you? Bringing the mind back to sensing if it gets lost in thinking. Next, shifting your attention gradually to locating 2 things that you can smell. Maybe fabric softener, your body, the air, grass, food. It's okay if you can't smell anything in particular, just notice what that experience is like, the absence of smell. And then shifting your attention to locating 1 thing you can taste. Maybe coffee, food, maybe nothing in particular again. Just getting curious about the sense of tasting. And soon you'll hear the sound of the bell. And this is our last chance to be attentive to sound, noticing the qualities of that sound, and really taking your time before we move into the rest of this presentation together, so having a little stretch or pause. So mindfulness is often defined as paying attention, on purpose, in the present moment, without judgment, to things as they're unfolding in your experiences. Do you notice how we touched on all the aspects of this definition in your 5 senses practice? Mindfulness is about the practice of observing what is going on inside and outside of you, without doing anything immediately to change it. This ability to experience a situation fully before responding is essential in many situations. Mindfulness is a practice that improves your ability to be less immediately reactive to everyday situations. It gives you a chance to take whatever time is needed before we respond. Mindfulness practices often involve a focus on the body sensations and on the breath because they're always present. For example, right now you can't feel a breath from 10 minutes ago, and you can't smell what tomorrow's lunch is right now. This is in comparison to our thinking, analytical mind, which can wander far into an imagined, and usually catastrophic, future and slide deep into past memories. And overthinking is often indicated in depression and anxiety conditions. So finally, here are some resources that go a little bit deeper into mindfulness practice because it does involve practice. There's the Headspace and Insight Timer apps or website. They've got lots of wonderful courses in of different lengths and help to monitor and remind you about practices. The charity, the Mindfulness Network, is offering lots of free guided practices with experienced teachers. I hope to see you there. And here is a link to some tracks that I've recorded. One is a 3-step breathing space, which I'd highly recommend as another mini practice, but there are some longer practices on there as well. I hope you enjoy that. Thanks very much for listening today, and I'd like to give thanks to everyone in the Peterborough Exemplar Project and the Cambridge and Peterborough NHS Foundation Trust who have contributed towards this project. This video has been developed in collaboration between the Peterborough Exemplar Project and the Psychological Wellbeing Service as part of Cambridgeshire and Peterborough NHS Foundation Trust. Please subscribe to the CPFT YouTube channel to receive alerts when new videos are uploaded, and check out our website at www.cpft.nhs.uk for further information.